by just making it clear that this is an Iowa Medicaid program, the Consumer Choices Option program. So this is not Veridian's program. We are the financial management service for the program. So we have a lot of operational knowledge about how the program actually works. And we're oftentimes the people that individuals who are using the program call with questions, et cetera. So we have a lot of knowledge about the program, and it's not our program. So a lot of times if I get questions about rules and regulations and things like that, I do like to direct you back to Iowa Medicaid and possibly the HCBS Specialist. So I say that at the beginning just to make sure that everyone knows that I can answer a lot of questions about the program, and I may not always be the best resource for every question about the program, but I can certainly point you in the right direction if you have some questions that I'm not able to answer. So I'll start off with some basic information about what the Consumer Choices Option program is. It's basically, again, an Iowa Medicaid program for individuals who have a disability or who are aging, who are on Iowa Medicaid's Home and Community-Based Services Waivers. HCBS is Home and Community-Based Services Waivers. And I'm going to go into a little bit of detail first about waivers before I even talk specifically about the CCO program. And I apologize if I have some people on the call here that really know all of this information, but I don't like to assume that everyone knows this piece before I move on to the next piece. So basically, there are 6 waivers that are eligible for CCO, for Consumer Choices Option. There are actually 7 waivers altogether. The one that is not currently eligible to self-direct services through the Consumer Choices Option program is the Children's Mental Health Waiver. But you'll see the other 6 waivers up here that are eligible to use CCO, and brain injury being one of those waivers. So to explain a little bit about what an HCBS waiver is, I like to first start off with just a basic overview of this, because a lot of times when people hear Medicaid, they hear doctor's visits and prescriptions and a little bit more of a medical focus. And while that is a big part of Medicaid, there is this other piece of Medicaid that really helps people with disabilities and the aging stay in their home or in their community, as opposed to going into a more restrictive living setting, such as a nursing home or a care facility. So a lot of times people are able to live in their home or in their community, but they just need some assistance in order to do that. And as we all know, it's much preferred for many people to be in their own home than in a setting such as a care facility or a nursing facility. And it is a very personal decision for families and individuals, but the goal of the HCBS waivers is really to keep people in their homes and in their communities. So I like to give some examples of what types of services are available under these HCBS waivers. So it might be something like respite. So if there's a primary caregiver that just needs a little bit of a break from their caregiving duties, they can hire somebody to come in and be with the individual with a disability or the elderly person for a while they're able to go out and just have a break. So that's respite care, and that would be one example of something that we frequently see under the Home and Community-Based Services waivers. Job support, so often individuals with disabilities are able to have a job and they want to have a job, but they need some assistance when they're on the job. So they can hire somebody to come with them to the workplace to help them and make sure that they're successful on the job. Personal care is a really big one, especially for elderly individuals where they're able to stay in their home, but they need somebody to come in and help them with bathing, medication management, mowing their lawn, cooking meals, things like that. So just those daily living types of activities. Supported community living would be having somebody really go out with you in the community to help you interact, and it might be learning how to ride the bus or navigate public transportation, or even just socialization. So those are just some examples of the types of services that are somebody is eligible for under an HCBS waiver. And I point that out because it is very different from what people typically think Medicaid provides. So the eligibility for these services really depends upon the waiver that somebody is on. So for example, somebody on the brain injury waiver will probably be eligible for different services than someone on the elderly waiver. And even within a waiver, the services are really tailored to that individual. So if there are 2 people on the brain injury waiver, they may not be eligible for the same services because they may not have the same needs. So it's very individualized. There is a waiting list for most of the waivers at this time, and currently the brain injury waiver, of course, is one that has a waiting list. There's almost 1,300 people currently on the waiting list. And so it's a big issue, and it's really a funding issue. And I know the Brain Injury Alliance of Iowa are huge advocates for change in this area. So if this is something that you feel passionately about, that we should be really supporting people in their homes and in their communities, especially people with brain injury, you know, Brain Injury Alliance is going to be a great resource. They do some awesome days on the Hill and legislative talking points, and are really just a great resource for that. So it is a big issue in the state of Iowa, the funding that we have for these waivers, and really it just takes talking to legislators and making sure that everyone knows that it's a priority to fund these services. Okay, so now that we've kind of talked about the waivers in general and what sort of services are available under the waivers, I want to go on to talking about the Consumer Choices Option, or the CCO program. And this is the self-directed option for individuals who are on the home and community-based services waivers. So what self-direction really ultimately means is that the person receiving the services has a lot more choice and control over who they're going to hire, what they're going to pay their employees, the scheduling, and really the day-to-day operations of the services that they are receiving. So under the CCO program, the CCO member actually becomes the employer. So as part of the enrollment process, the member gets set up with an employer identification number. They are the employer. And so really, I think that's the very cool aspect of this program. It really promotes self-determination and taking back that control of how services are provided. So they get to choose their own employees. A lot of times people are choosing neighbors to help them out, or family members, or friends of the family. So really having that choice of who is going to be helping you with your services. They're able to determine wages to some extent, and I'll talk about that a little bit later in the presentation. And then really that scheduling component is huge. So the person receiving services is able to say, this is when I want somebody to come in and help me with these things. So all of that is really the essence of the self-directed piece of the Consumer Choices Option program. So this is my attempt at showing simply the difference between traditional waiver services and self-directing services through CCO. So if somebody who, first of all, they have to already be on a waiver, not on a waiver waiting list, but once somebody is eligible to actually start receiving HCBS waiver services, they can either choose to go through a traditional agency to get their services provided. And this would be a typical Medicaid approved agency to receive their services. So the member would work with an agency, the agency would hire employees and is the actual employer of the employees. Now under the self-directed model through CCO, if they choose to self-direct their services, the member hires the employees and is actually the employer. And then Veridian becomes involved because we assist with the payroll processing and all of the back end work. And again, I'll get into our role here in more detail, but that's essentially, hopefully that kind of lays out the differences between traditional waiver services and the Consumer Choices Option program. The other thing that I want to point out too is that the Consumer Choices Option program is not a new source of funding. It's just a different use of existing funding. So it's just saying, I'm going to take these HCBS waiver dollars and instead of going through an agency, I'm going to choose my own employees. So just briefly, Veridian has nothing to do with the enrollment process of signing up for a waiver. So of course, that's the first step. You have to be eligible to receive waiver services. You can do that online. You can call IME, which is Iowa Medicaid Enterprise Member Services, to find a local DHS. But basically, you're going through a case manager to see if you're eligible for the waiver services. Once you are able to actually receive waiver services, that's when those discussions would be had about whether you want to go through a traditional agency or self-direct your services. And we've already talked a little bit about the waiting list for the waivers. So the people that are involved in the Consumer Choices Option Program, I just kind of have some of the key people listed out here, because a lot of times people hear self-direction, so I'm self-directing my services. Well, there are still people involved to help support that. So the case manager is still really involved in the CCO program. So if you're self-directing services, case manager is still going to be involved in helping to determine needs, et cetera. You also have something called an independent support broker, and I'm going to be talking about this role in a lot more detail, but just want to point it out here that the independent support broker is somebody that is going to be able to help support the CCO member through this process in terms of developing a budget and helping them access services, et cetera. And then there's the financial management service, or the FMS, and that is our role at Veridian. And again, I'll go into a lot more detail about the types of things that we handle. There's also an entity called an HCBS Specialist, and they are a great resource for any waiver-related questions. So regardless if you choose to go through a traditional agency or to self-direct services, if you have questions regarding the HCBS waivers, such as allowable services, or how to develop a budget under CCO, et cetera, the HCBS specialists are a great resource. And a lot of times when I get questions on regulations or am I allowed to do this, really I get you back to that HCBS specialist, because they're kind of the expert in this area. And then coming soon, I'm sure many of you have heard, will be managed care organizations that will also be involved in the Consumer Choices Option program. And I have a little bit of a section at the end to talk about that in more detail. So these are just the basics of who remains involved in if somebody chooses to use the Consumer Choices Option program. So first thing, case manager, they are really the ones who are determining needs. They're developing a service plan, and that helps determine the monthly amount of dollars, Medicaid waiver dollars, that are available to the CCO member. The case manager can also assist the member in choosing an independent support broker, and then ultimately they're responsible for monitoring services to make sure that needs are being met. So case manager says that this individual needs supported community living and supported employment. Well, are they actually accessing all of the services that they're eligible for and that they need? So that's the role of the case manager, and they're just as involved if somebody chooses to use CCO as they would be if they chose to go through a traditional Medicaid approved agency. The independent support broker is a really unique role with this program. So the role of the ISB is really to help the CCO member develop and maintain their budget. So if the case manager is determining needs, so they're saying you have X amount of dollars and you have needs for respite and supported community living, then the ISB comes in and helps create the actual budget and lays out how those needs are going to be met. So they will sit down with the member and say, okay, you have this number of dollars for respite, this number of dollars for supported community living. How are we going to get those needs met? Who are you going to hire? What are you going to pay them? How do you want to schedule them? Because it's a self-directed program, really that's the members, the CCO members' role to determine all of that. And then the ISB is there to help guide them along, answer questions, and make sure that it all works out within their monthly Medicaid approved budget. They also are a great resource to answer any questions about paperwork. So I'll talk a little bit later about how the process actually works when there is a new CCO member and we send out all of these packets and this paperwork. The ISB can actually sit down with the CCO member and help fill out all of that paperwork. They're very knowledgeable about all of the paperwork, and part of their role is to make sure that that enrollment process goes smoothly. They help the member develop an emergency backup plan. So if you are hiring your own employees and you only have one employee that's approved to work for you and that employee is not able to work, the ISB needs to make sure that you've got a backup. So if this person's not able to work, what are you going to do to make sure that you're getting your needs met? And then they also review monthly statements to make sure that everything looks correct. We rely a lot on the ISBs for communication if there are ever any payroll questions, anything like that. So the ISB is a really great resource. They are paid out of the member's CCO budget. So the ISB is paid for their services, and it doesn't come out of the member's pocket. So when the member gets this lump sum of money for the month for their services, for their HCBS waiver services, out of that automatically comes Veridian's financial management service fee and the independent support broker fee, and then the rest of it is available for services. So again, it's not coming out of the member's pocket, it's coming out of their Medicaid budget. I do like to kind of talk a little bit to you about the independent support broker as an entity, because some people are actually interested in becoming an independent support broker. We have a lot of unique situations with the independent support brokers. We have some people who are both recipients of Medicaid waiver services and independent support brokers to others. Or oftentimes we have parents of a child who's on the CCO program becoming an independent support broker for other individuals. A lot of times those are really great support brokers because they really know the program inside out and they really have a connection to why this program is so important. So I just wanted to talk to you a little bit about what it would take to become an independent support broker if it's something that you're interested in. So the qualifications for an independent support broker is they do have to pass a background check, attend independent support broker training, which is put on by Iowa Medicaid currently, and I do have a little bit more information about that here on the next slide. And then they also do have to be certified as a mandatory reporter in dependent adult and child abuse. And then the restrictions for the independent support broker is they can't have a conflict of interest. So for example, a support broker cannot be the support broker for a member that they also work for. So the support broker is helping to determine schedules and wages and everything like that. So that would definitely be a conflict of interest if they were doing that as a support broker, but then kind of putting themselves on the budget to work. So that'd be one of the common conflicts of interest. They can't be the spouse of the member or the parent of a minor. So how to find an ISB? When somebody joins the CCO program, the case manager can just assign an ISB if there's not anyone that you know of that you would like to use as an ISB. Iowa Medicaid maintains the list of all active ISBs. And then we also try and keep a link to that ISB list on our website, which I hope to show you here later in the presentation. And ISBs are listed by county. So when somebody becomes an ISB, they say, I'm willing to work in Black Hawk County and Bremer County. Or they could say, I'm willing to work in all 99 counties, because a lot of the work is actually done, over the phone or by email, etc. So that's how you would really find an ISB. Some people will actually interview ISBs, call and talk to them, and talk about the way they do their ISB work. So it's completely up to the member, because the member is the employer of the ISB. So they're the ones that are choosing the ISB, and the case manager can help choose an ISB if the member doesn't know who to pick. Some of the questions that we get are, what if I have a complaint about my ISB? Well, the CCO member is, again, the one who employs the ISB. They're not employed by Iowa Medicaid, and they're not employed by Veridian. The member is the one who employs them, so they always have the right to switch ISBs. So if you're not happy with your ISB, you can find a different one by referencing that list. If there's a complaint that you actually feel needs to go beyond just switching ISBs, There is an entity called an HCBS incident, which I just realized I spelled incident wrong, Incident and Complaint Specialist, and that's found on the HCBS waiver map. And I have also listed their contact information right there. I do want to show you the HCBS waiver map because I've talked about these individuals a couple times now, and again, these are the ones that are great resources for any waiver-related questions, and they are broken up into regions as well. So you'll see that Julene takes care of these counties. But down here at the bottom, there's this incident and complaint specialist, Sheila Leonard and Stephanie Jones. So they're good resources if there are any complaints that have to do with anything waiver related, including the ISBs. Oops. Oh, just a minute here, sorry about that. All right. Okay. And if you do want to change ISBs, you would just notify your case manager, because the case Medicaid is responsible for the ISB training, and actually those HCBS specialists are the one that put on the training. So there's 4 different modules that you would go through, and they're all online. And there's a quiz at the end, a sample budget scenario, and then there is a live webinar that is done generally quarterly, and that helps. Veridian's involved in the live webinar piece, and we really go through all of the packets, et cetera, and that's the training that the support brokers get to make sure that they're really familiar with all of the documents, et cetera. And then that also allows the new ISBs to ask questions if they have any. And then they have to go through the mandatory reporter training and background check process. And then this is the website that has information about the ISB training. And this is what the website looks like. So this is on the DHS website, independent support broker training. There are the 4 modules, the quiz questions, the budget scenario, and then this is the information about the live webinar. So the next one is coming up on November 17th, and it's in the evening. So that's all the information here about independent support broker training. And I believe that on the webinar details, there are some, let's see here, some handouts. I don't know if you can see my screen here, but on this handout, I believe that I have the link to that website. All right, so going on now to the financial management service. That is, again, Veridian. We are the only financial management service providing this service for the Consumer Choices Option Program. And we've been doing this since the start of the program, which was in 2007. So some of our responsibilities are, I kind of like to explain our responsibilities as all of the back-end stuff that nobody really thinks about or wants to deal with in terms of actually becoming an employer. Since the member actually is an employer, there's a lot of things that go into that that people may not even really think about. So we also provide that oversight. So yes, it's self-direction and it's Medicaid funds. So we need to make sure that they're being used in the way that they were intended to be used. So I think it's a little bit best of both worlds. There's self-direction, a lot more choice and control in what you're doing with your services, but there's still that oversight to make sure that the funds are being used correctly. So some of our responsibilities are we receive Medicaid funds on behalf of the CCO member. We process all of the paperwork required to start the CCO program. And that's for members, employees, support brokers, And then for the employees, we do submit a background check to DHS for DHS to run the background check on all employees that the CCO member chooses to hire. So there is a lot of choice in who the member hires. However, they do have to pass that background check piece before they can start working. We process a semi-monthly payroll. So we pay twice a month, and we make sure that all payroll taxes are withheld. We bind workers' comp coverage, establish unemployment accounts, and provide monthly statements. So we do a lot of this back-end stuff that really you don't kind of think of. So the workers' comp piece is really important. So if an employee gets hurt while they're working for a CCO member, the member does have workers' comp coverage to, protect both them and that employee. And then also unemployment accounts as part of a responsibility of actually being an employer, they have to pay into the state unemployment tax insurance accounts in case somebody is involuntarily let go. They are able to file unemployment just like any normal employee at a normal place of business would be able to. And that's all factored into their budget that they create as well. But from an employee's perspective, this is really a benefit over, there are some programs like CDAC where the providers are independent contractors and they don't have these protections in terms of workers' comp insurance and unemployment insurance, those types of things. So again, I've already really kind of gone over the HCBS Specialist, so I'll breeze through this slide, but you can find the HCBS Specialist online. So I do want to talk a little bit about hiring employees because this is what a lot of people have questions about. Who can a CCO member hire? And really, it's pretty open. The eligibility for hiring somebody is they do have to pass a background check, and they have to pass that background check before they start providing services to the CCO member. If they start providing services before they are approved by DHS, the CCO funds cannot be used to pay them. So it's really important that they wait for that background approval before they start providing services. They can't be the spouse of a member, and they can't be a parent of a member who is under the age of 18. And there's a couple of little age restrictions. They have to be 16 years or older to provide some of the personal care type services, and 18 years or older to provide anything skill related. So that's really the eligibility. I talked a little bit before about paying employees, how a CCO member can determine employee pay rates. So with that, they need to make sure that they're following state and federal labor laws, and they also, so that means they should be paying at least minimum wage, and then they also need to stay within their monthly Medicaid CCO budget. So they can't pay a huge salary to somebody or pay rate to somebody because it wouldn't allow them to get all of their service needs met within their monthly Medicaid budget. But there is a range of what people can pay their employees. So sometimes people will pay an employee who has been with them for longer a higher rate than somebody who has just started. And that's one of the pretty cool aspects of the program, is really that control over pay rates. And then again, we've already talked about the importance of having an emergency backup employee. This really comes into play, especially with that background check piece, because employees are required to pass that background check before they can start working for the CCO member. And so if they don't have an emergency backup employee in place, they would have to wait for a new employee to go through that whole background check process before they would be able to actually start working for them. So we just like to stress the importance of having that emergency backup in place. Let's see here. So ideas on how to find employees. This is a pretty common question. This is a self-directed program, so finding the employees to work for you is really the responsibility of the CCO member or their support network. So a lot of times people already have employees in mind that they want to hire. Again, sometimes it's family members. We have a lot of instances where individuals that have children will be hiring grandma to provide respite care, things like that. So there's some really unique employment situations that happen with the CCO program, and again, it just gives a lot of control over how to do that. So really with any of these approaches to finding employees, it's really important that the CCO member and their support network is comfortable with it. So these are just some suggestions of things people have done. So tapping into the natural supports that are already helping the CCO member. So that's family members, friends, neighbors. The ISB or the case manager may know of some available employees that are working with other individuals that they work with. So that might be a resource they could look into. And then sometimes people even advertise for employees. So here in Cedar Falls, where I am, we have the University of Northern Iowa, and there's a school of special ed. And a lot of times those students are really interested in working with people with disabilities, et cetera, to try and get some experience. And that's a great place that I know some people have found success in finding employees by advertising at places like that. Community centers, there's some online resources for hiring, et cetera. But again, all of these things would just be a personal decision for that CCO member to make to determine if they're comfortable finding employees in that manner. I want to talk a little bit about what the process actually looks like if someone chooses to self-direct their services through CCO, and a little bit about the paperwork. So I'm not going to go into great detail about this because that could be a 2-hour webinar in itself, and we don't have time for that. But basically, if somebody is eligible to receive HCBS waiver services, they're working with their case manager, and they have those discussions and they decide they want to use the CCO program. The case manager will let Veridian know that there is a new CCO member, and they do that through a web-based system that they have. So Veridian checks that on a daily basis, and when we're notified of a new CCO member, we send out 3 packets: a member packet, an employee packet, and an independent support broker packet. All 3 of these packets are sent directly to the member since it's a self-directed program. And there's a lot, I'm not going to lie, there's a lot of paperwork to be filled out to start the CCO program, just as there is with any state or federal funded program. And we try and make it as clear as possible and as quick as possible to fill it out. So we have everything really clearly highlighted, any place that it's a requirement to actually sign a document. And the support brokers, I mean, this is their specialty. This is what they do every time that they meet with new members, is they're helping them fill out this enrollment paperwork. So a lot of times people will just kind of put the paperwork aside until their ISB gets there, and the ISB can help them go through everything really quickly. So all of those enrollment packets then are filled out and sent back to Veridian to start processing. And then you just work with the case manager and the ISB to make sure that you knew when services were actually starting, when you could actually start hiring people. And again, the big piece to remember is that employees cannot start providing services to a CCO member until they've passed the background check. So some of the responsibilities of the CCO member would be to help the ISB create that budget. So it's a self-directed program, and really that input from the member about how they want their services to be provided is crucial. And when we say that the member is self-directing services, a lot of times it is that individual, and sometimes it's their support network. So they are able to have, especially if it's a minor child, they can, their parents are helping self-direct the services. And if it's somebody who just needs a little bit of extra assistance, they can assign somebody to help them sign timesheets and budgets and things like that. They are responsible for finding and hiring employees. They are also responsible for firing employees if that employment relationship doesn't work out. They're responsible for figuring out schedules for their employees, and they do need to approve employee hours. We have an online system that's really slick for people to enter and approve hours online. We also have a paper timesheet option if online doesn't work for people. And then they need to monitor and budget their services. Again, it's self-directed, so they need to make sure that they're not scheduling their employees more hours than they have budgeted. So kind of monitoring that service. So I want to show you real quickly our website, and this is how people actually enter and approve hours online. The employee has to enter the hours worked, and then the member goes in separately and approves the hours worked. So, for example, I'm just going to pull up, this is a fake test person. So basically, the employee would log in and say, I want to add hours, and it is for respite, and I worked today from 8 a.m. to 11 a.m. and I provided respite, and then I click save. And those hours are added, and you'll see that they say not approved. So the employee has done what they need to do to add the hours. So I'm going to sign out as the employee. I'm going to go back in as the member. And the member then can look at this and say, okay, yep, they worked on November 4th from 8 to 11, 3 hours of respite. Perfect. And I'm going to click not approved, and that turns to approved. That's all they have to do. It's a really user-friendly, simple system, and it has input from the employee as well as from the employer or the CCO member. Once those hours are approved, Veridian knows that those are okay to pay. We pull them into our payroll software. We match it up with the budget to make sure that it all corresponds with the budget, and then those hours are paid. So pretty user-friendly system. And let's see here. Okay, there we go. So I want to talk real quickly about what I see as the advantages of the Consumer Choices Option Program. So I really like to start off by talking about choosing to use a traditional agency or self-directing your services is a really personal choice. So self-directing services is not for everybody. We never expect that everybody who's on the HCBS waivers will want to self-direct their services or be able to self-direct their services. A lot of times, if somebody doesn't have a good support network around them, or doesn't have a lot of people in mind that they want to hire, sometimes traditional agencies are still obviously going to be the best route to go. So traditional agencies provide awesome services, and I do think it's really important for people to know that there is the option to self-direct services. So it really just involves a lot of discussions with family members, your support network, possibly your potential employees, so the people that you're thinking of hiring, and then your case manager. So all of those people can probably help provide some input about whether self-directing services would be a good option for you. Some of the advantages I think there are to self-directing services are it really does put more choice and control back to the person who is actually receiving the services about how their services are provided. And I think that's pretty key. I mean, if I'm going to be receiving services, I really want to have a say in how those services are provided. So, I mean, to me, that's really the biggest advantage and piece to this. There is the potential for increased services if the CCO member uses their budget efficiently. So let's say a CCO member is hiring mostly family members who would probably be providing this help without any pay anyway, but it feels good to be able to provide them some sort of compensation for what they're doing. And so we've made an arrangement that, you know what, I'm going to pay you an hourly rate at minimum wage, and I actually am able to get all of my service needs met by paying a minimum wage, and I have this amount extra left over in my budget. I could actually choose to save that extra amount toward an item or a service or something that would be a little bit more non-standard, that you might not be able to get under a traditional Medicaid plan. Now, there are some restrictions to that and some guidelines that gets a little bit complicated and would probably involve much more time than what we currently have. So I can certainly answer some specific questions about that, but just know that there is sometimes the option to save for additional items or services if they're using their budget efficiently. What we hear a lot is that rural areas, sometimes it's really difficult to access traditional agencies in these rural areas, but maybe there's somebody, you know, a neighbor or somebody from your church that's able to come over and help you do these things. So being able to have the flexibility to do that is really cool. This obviously is a program that fully supports community inclusion, and we've had some really great success stories about why it's important to be able to choose your own employees, especially for maybe teenagers who have a brain injury or an intellectual disability or something like that, to be able to hire you know, friends from their high school to be able to help provide supported community living or job support. You know, I really think that that does promote community inclusion and inclusion in the schools and in your job, et cetera, and sometimes might feel a little bit more natural than hiring, you know, doing that through an agency. And not to say that an agency wouldn't provide an awesome resource for that, it's just a different way to get those services provided. And then this program is cost effective for the state and taxpayers. So this program must be cost neutral or cost savings. So, you know, we hear so many times about how we need to cut the Medicaid budget or save money, and this is a way that this is actually working and still providing just awesome services. Because with this program, you know, these funds aren't going for the overhead of building and all of those things that traditional agencies have. So a lot of times what you see is more money is actually available for services. So to me, I think those are some of the big pieces to why CCO is such an awesome program. And I could go on and on about that and give you specific examples of, you know, how things have worked well for our members, and we're kind of running out of time here. So I do want to talk just briefly about Medicaid privatization, because it's been in the news a lot and there's been a lot of talk about it. So as far as we know, starting January 1st, 2016, there will be 4 managed care organizations, or MCOs, who will be administering the majority of Medicaid programs, and this does include the HCBS waivers and the CCO program. So this was being referred to as Medicaid modernization, and it's now being referred to as IA Health Link. So you may be seeing a lot about that coming up. The 4 MCOs who will be administering the Medicaid program have been selected, and they're listed here: AmeriGroup, AmeriHealth, Caritas, United Healthcare, and WellCare. And we do expect that under managed care that Veridian will still be a financial management service for the CCO program, and will essentially perform the majority of the duties that we do today. We do know that some things may change slightly, and we do expect that we will have essentially the same role that we have today. So today, if somebody called us because they had a question on their payroll or on their timesheet, they would still do that come January 1st. And we're currently working with all 4 MCOs to make sure that this implementation goes smoothly for CCO members and employees, and really our goal in this is to make things as seamless as possible through the transition. So we do see some great opportunities that could come out of partnering with the MCOs, and I'm just excited to see where it goes, and I'm excited that we're still going to be able to be involved in this really great program. So if there are any questions about Medicaid privatization and how it will affect basically anything, not just the CCO program, I have provided a couple of resources here that you can reach out, just general stakeholder comments, if you're actually a Medicaid member or a Medicaid provider. There are a couple different places that you can reach out to. And then lastly, I just have some resources here that we've talked about throughout the program, where you can just get general waiver information, the Iowa Medicaid website for CCO, and then also our website. I just showed you the website that we have that's specifically for CCO. So I feel like I talked really fast through all of that, and I wanted to leave about 10 minutes at the end for questions, and so we're at about 12 minutes here, so I definitely have time for questions if anyone has anything, or if there's anything that I talked about that you need more clarification on, I'd be happy to talk about that. Annie, do you know if we have any questions that have popped up?
Hi, Holly, are you there? This is Annie. Sorry, I had some issues with our speakers there. If you guys can hear me, Holly, if you can hear me, let me know.
I can hear you.
Okay, perfect. Okay, we're back. So we do have a question, and it's from Bonnie. What happens if the employee and our member disagree about hours worked in the online payroll option? What do you do?
So that's a great question. The employee is the only one who is able to enter, edit, or delete hours, and that's to make sure that the employee has input. However, if the member goes in and sees those hours and says, nope, those hours weren't worked, or there's something wrong there, they simply need to not approve those hours. So when I click to be not approved and it changed to approved, they would just need to make sure to not approve those hours. Veridian will not pull over any hours that are not approved. So and then at that time, they would need to go back to the employee, talk to the employee, was it a mistake? Like that happens a lot. Maybe somebody just entered something incorrectly, and if that's the case, then as long as the hours are not approved, the employee can go back in and change it, et cetera. Now, if it's actually something where the employee says they worked the hours and the member says, no, you didn't, that's a totally different situation, and they would, as the employer, they would need to kind of work through that with the employee, and they could certainly bring in the support of some other people if they needed to. But generally what we see, if there is any sort of dispute like that, it's because there actually just was a mistake in entering. Did that answer the question?
I think that should. The next question is from Ashley, and she's wondering, could you tell us an estimated fee for the ISB and Veridian?
Absolutely. So Veridian's FMS fee, Financial Management Service fee, is a flat fee each month, and it's $66.95, and that is set by basically the legislature. So that's not something that we have a lot of control over, and that comes again directly out of the Medicaid budget. And then the independent support broker fee also is set in a similar way, and they can charge up to $15.91 per hour, and they can work up to 30 hours per year per member. And there's some additional kind of guidelines along with that as well. but really the independent support broker should probably only be billing for hours that were actually worked, and they do document the hours worked on a timesheet that the member needs to sign off on as well.
Thank you. The next question is from Terry. Can a brain injury waiver CCO participant utilize a service typically under elderly waivers such as companionship?
That might be a good question for an HCBS specialist to make sure that you're getting the absolute correct answer, because that's kind of an allowable services type of question. But my understanding is that under CCO, it still has to be services that would be eligible under the, so if it's brain injury CCO, it needs to be services that you would be eligible for under brain injury traditional waiver services. So if it's not something, if companionship, for example, is not normally under the brain injury waiver, I don't think that that would probably be something that would be eligible for under the CCO program, but I would like to have that question probably directed to an HCBS specialist to ensure that that's accurate.
All right, thank you. And the next one is from Bonnie again. What kinds of activities do ISBs bill for?
Great question. So they would bill for if they are creating a budget, and that can be, depending on how involved the member and the ISB get in that process, that can be an hour, it could be less, it could be more. They can bill for any changes that they make to a budget. So if somebody decides that they want to hire a new employee, then a budget needs to be updated and submitted to Veridian. They can bill for communication between, if they're calling to check in with the member, or if Veridian has contacted the ISB because of any payroll issues, et cetera. All of that is billable. Reviewing statements is billable. Communicating any changes to the program. There's lots of different types of things that are billable. So any support that the broker is providing to the member is billable up to those, hour restrictions. And also it really needs to be communicated between the independent support broker and the member how much involvement they want the ISB to have.
And also from Bonnie, she also asked, how often should a member see their ISB? Is there like a minimum or amount of hours?
Iowa Medicaid has a couple of guidelines in place for that, especially when somebody is starting up the CCO program. They want a little bit more involvement. But otherwise, there are some people who, the CCO program is running smoothly. I'm not changing, my service needs haven't been changing. I'm not hiring new employees. So, if the ISB is not needed in those situations, then maybe they're just doing a monthly review of statements and emailing to check in to say everything going okay, and it'd be very minimal contact. But again, that CCO member is the employer of the ISB, so between the ISB and the member, they would want to work out that relationship.
Thank you. And then we have another question from Ashley. Are the ISB complaints tracked?
We have a tracking system internally so that we're tracking any complaints, whether it's from an ISB, an employee, a member, et cetera. And how the HCBS specialists track ISB complaints, I am not sure. I'm guessing they have some sort of tracking mechanism, but I am not positive about that.
Okay. And then she's also wondering, what is the average length for the background check to get back?
Oh, that's the million-dollar question. That would be that's the pain point with the CCO program at this point. And they can take up to sometimes 6 weeks to come back, and it should not be that way, probably. Well, it shouldn't. So Veridian's involvement in the background check process is the background check form to authorize the check to be performed is included in the employee packet that's sent out. So the potential employee fills that out, sends it back to Veridian, and then we submit it to DHS to actually run the background check. Now, DHS runs background checks for all of the potential CCO employees, CDAC employees, all sorts of other DHS-related programs. So they oftentimes are quite backed up in their process, and so it takes much longer than we would like to happen. Now, this is one of the areas of opportunity that I'm looking for under managed care. It's my understanding that it's possible that the background check process will be done differently under managed care, and I would hope that that would mean that after January 1st, it might be a quicker process. Because I don't have a lot of details on that, I can't guarantee that, and that would be my hope, because that is the pain point that we've identified with the CCO program, is the length of the background check process.
Yeah. Okay, and then the next one is from Angela. How is the monthly Medicaid CCO budget determined? And I can't remember if you went over that already, but if you can give a little insight to that too.
Sure, that would be based on the involvement of the case manager. So the case manager would sit down with the CCO member and really determine the needs, and at that time the monthly budget amount would be determined, and then also within that there is basically a cap amount for each waiver, so that it couldn't exceed that. Typically it wouldn't exceed that cap amount.
Okay. And then also from Ashley, can we get feedback on the complaints on the ISBs? Is it public?
Nope. Well, from our end, we would not be able to provide any information just due to privacy on the ISBs. Now, from the HCBS Specialist, I'm not sure if they do that or not. So I think because the HCBS Specialists are the ones, the incident and complaint specialists are probably the ones that would have the more formalized complaints. I think that would be a good question to direct their way. And I don't think that Veridian would probably be able to provide specific information on specific ISBs, partly because they are not our employees. We're providing payroll only for the ISBs.
Thank you. And then I think we have time for one more question, and it's from Christy. Can a traditional service provider organization become an ISB?
Again, I'd probably refer that to an HCBS specialist. I think somebody who works at a traditional agency could become an ISB. However, they could not be an ISB for any individual who also receives services from that agency. But again, to make sure that that's accurate information, I would like that question to be confirmed with an HCBS specialist.
Perfect. Thank you for answering those questions. And then everybody, we also have attached a handout and the PDF file of the PowerPoints today, along with the GoToWebinar. So if you can see in your handout section of your control panel, those documents should be living there. So feel free to click on those and print those out if you'd like to have a copy of those. We can also attach those when we record this webinar and have them available when you can view the webinar. Probably early next week is probably when it will go onto our website. But thank you again, Holly, for your webinar today, and I know that this is really helpful to a lot of people just wanting to know how they can get started and how they can manage the CCO option for themselves and if it works for them or someone they care for. So thank you again. Do you have your contact information that you could put up on the screen, or maybe the first slide again so people could see that again?
Yeah, let's see here. I'm just going to type it in here.
Okay. And then while she's doing that, just another reminder for anybody who is listening today that the Brain Injury Alliance, our main program is our Neuro Resource Facilitation Program. So if you are looking for supports for getting connected to new sort of services in your community throughout Iowa, feel free to give us a call. We can help people navigate information around brain injury and how to connect to any sort of services that you feel you're needing. So if you have any additional questions today about this webinar, feel free to give us a call or to connect with Holly. And her information is now up on the screen, so feel free to write that down. But I think that was very helpful for everybody, and thank you again, Holly, for your time today.
Yeah, thank you for the opportunity. I love to talk about this program and our partnership, so I appreciate it.
Well, thank you, everybody. I hope you have a good rest of your day, and this will go up on our website hopefully early next week. So thank you all for watching. Bye, Holly.
Bye.